Welcome to my channel Natural Cures. Ginger for diabetes is one of the few products that have a low glycemic index and a high biological value. But despite its healing properties, the root of this plant is not a substitute for drug therapy. This is especially true for type 1 diabetes, because in this case, the patient must inject insulin to normalize his health. If a person suffers from type 2 of this disease, in some cases he may not need to take a pill. Diabetics should know. Sugar is natural for everyone. It is enough to take 2 capsules every day before meals. In such cases, diet and folk remedies are good help for the patient on his way to stability. But before using any unconventional treatment options, including those that contain ginger, a diabetic must consult an endocrinologist in order not to harm his body. Chemical composition. Ginger contains very few carbohydrates. The glycemic index is only 15 units. This means that taking this product does not cause severe fluctuations in blood sugar and does not lead to an increased load on the pancreas. The root of this plant contains a large amount of calcium, magnesium, phosphorus, potassium, selenium and other useful small and large elements. Because of its rich chemical composition and the presence of almost all vitamins in ginger root, it is often used in folk medicine. Ginger for type 2 diabetes helps maintain normal blood sugar. This is due to the fact that the formation of the root of this plant includes a special substance, gingerol. This chemical compound improves the ability of muscle cells to break down glucose without entering insulin directly. As a result, the load on the pancreas is reduced, and the person's condition is improved. Vitamins and trace elements in ginger improve blood circulation in small vessels. This is especially important for the eye area, especially the retina, since vision problems occur in almost all diabetics. Ginger to reduce sugar and enhance overall immunity. In order to maintain good immunity and control blood sugar levels, you can use ginger-based products periodically. There are many popular prescriptions for such drugs. In some, ginger is the only ingredient, in others it is combined with additional ingredients that enhance each other's work and make alternative medicine more useful. Here are some recipes for your body that boost your immune system and regulate your sugar levels. Ginger tea. To prepare it, you need to cut a small piece of ginger root, about 2 centimeters long, and pour it with cold water for 1 hour. After that, the raw materials and grated should be dried into homogeneous porridge. The resulting mass should be poured with boiling water at the rate of 1 teaspoon of the mass per 200 milliliters of water. This drink can be drunk in pure form instead of tea up to 3 times a day. It can also be mixed in half with weak black or green tea. Ginger tea with lemon. This too is prepared by mixing the grated root of the plant with lemon in 2:1 proportions and then pouring it with boiling water for half an hour, 1–2 teaspoons. Block per cup of water. Thanks to the ascorbic acid in the formation of lemons, not only immunity, but also blood vessels are enhanced. Ginger for diabetes can be considered as food, which adds it to vegetable or pastry salads. The only condition is the natural tolerance of the product and its fresh use. It is only beneficial under this condition. Ginger powder, or pickled root in diabetes, is not desirable, as it increases acidity and irritates the pancreas. Help with polyneuropathy. One of the manifestations of diabetes is polyneuropathy. This is a lesion of nerve fibers, which due to loss of sensitivity of soft tissue begins. Neuropathy can lead to serious complications of diabetes, diabetic foot syndrome. These patients have problems with normal movement, and the risk of amputation of the lower extremities increases. To normalize blood circulation and soft tissue intolerance in the legs, you can use oil with ginger and St. John's wort. In order to prepare it, it is necessary to grind 50 grams of dry leaves of hot pepper, pour a cup of sunflower oil and heat it in a water bath at a temperature of 45 to 50 degrees Celsius. After that, The solution is poured into a glass container and insisted in a warm dark place for 24 hours. Filter the oil and add 1 tablespoon of chopped ginger root. The tool is used to massage the lower extremities in the morning and evening. In time, this procedure should take 15-20 minutes, and massage movements must be performed easily and smoothly. Diabetics are usually taught self-massage techniques in special rooms of the diabetic foot, which are located in clinics and medical centers. After the massage, the oil should be washed, because ginger vigorously stimulates blood circulation, and exposing the skin for a long time can lead to a simple chemical burn. If the procedure is performed correctly, the patient feels warm and a slight tingling sensation, but not a strong burning sensation. Treating skin manifestations from diabetes. Due to poor carbohydrate metabolism, diabetics often have rashes in the form of small pimples and boil on the skin. Often this appearance occurs in patients with low blood sugar levels, or diabetes mellitus is complicated and difficult. Of course, to get rid of the rash, you must first normalize the sugar, because without this, external methods will not bring the desired effect. But in order to dry up the current rash and speed up the skin's cleansing process, you can use folk remedies with ginger. To do this, mix 1 tablespoon. 2. Grated on a fine grater root with 2 tablespoons. 2. Sunflower oil and 1 tablespoon. 2. Green cosmetic lamp. Such a mixture should be applied only vertically to the inflammatory elements. It is impossible to smudge it with healthy skin, as this can cause dryness and cracking of the skin, as well as feeling tightened. The treatment mixture is kept for about 15-20 minutes. It should be washed with warm water and dried with a clean towel. Usually, after the second procedure, the condition of the skin improves significantly. But to achieve the maximum effect, a course of 8 to 10 sessions is required. If this person, while using this type of ginger for diabetes, feels strong allergic to the skin, or sees redness, swelling, he should be washed off immediately and consult a doctor. Similar symptoms may indicate an allergic reaction to the components of folk remedies. Contraindications. Knowing the beneficial properties and contraindications of ginger for diabetes, you can get the most out of it without risking health. Diabetics should not use this product for such conditions and associated diseases. Inflammatory diseases of the digestive system. Fever. Hypertension. Violation of the conduction of the heart. The period of breastfeeding for women. If, after consuming ginger, the patient feels increased excitement, fever, or has trouble sleeping, this may indicate that the product is not suitable for humans. These symptoms are very rare, but if they do occur, ginger should be discontinued in any way, and it is advised to consult a doctor in the future. It may be enough to adjust the dose of this product in the diet, or perhaps it should be completely eliminated. In patients with type 2 diabetes, while taking ginger, they often notice increased tissue sensitivity to insulin and low cholesterol. Despite the fact that this product has been used for food and traditional medicine for quite some time, everything about ginger is still unknown to official science. The root of the plant possesses a huge potential of beneficial properties, but it must be applied little, carefully and necessary to monitor the individual reaction of the body. How to use ginger root with high blood sugar. It is simply necessary to follow a diet for diabetics. Using ginger at the same time, flavored shades can be given to fresh food products, as well as getting mineral complexes and nutrients and lowering blood sugar. Additionally, diabetes occurs mostly in overweight or obese people, and ginger contributes to weight loss. It is better to consume ginger in the form of fresh juice or tea. This is important. It should be used only by those patients who do not take anti-fever medications, and have been able to control their sugar level with the help of a diet. as the simultaneous use of these medications and ginger enhances the effect of medications, and sugar levels can drop a lot, which is very dangerous. Ginger use for diabetes should only be approved by an endocrinologist. In case of an overdose, vomiting, diarrhea, nausea, and allergy may occur with this plant. Allergies can occur not only from an overdose, but also in people subject to various allergic reactions. Therefore, it is worth starting to take the root with a minimum dose. It should be borne in mind that the ginger on the shelves of our supermarkets is of imported origin, and as you know, all imported products of plant origin increase the shelf life exposed to chemicals, and ginger is no exception. To reduce the potential toxic effects of these products, ginger should be cleaned and placed in a container of water for an hour before use. Ginger tea. Diabetes treatment with ginger root is possible in the form of juice or tea. To make tea, you need to peel a piece of the root, then soak for an hour in cold water, and then pour it or cut it into thin slices. Place the chips in a thermos and pour boiling water. Apply before meals for half an hour 3 times a day, in addition to traditional or herbal tea. Please subscribe and likes and commenter.